When you look at the contributions that our residents have made to research, they compare very favorably with the contributions from any other radiation oncology residency program in Canada, and even, as a matter of fact, any other radiation oncology residency in the world. What we try to do is we try to do two things. The first thing is to find a project that really meets the residents' interests. And we find that if we can do that, if we can match a project to a resident, then the success rate is really high. Nobody wants a project they don't like, it just never gets done. And so we've gone with all kinds of things that residents have liked to do. We've had a resident design an anatomy boot camp for other residents that has now trained over 500 residents around the world. We've had residents do randomized trials, systematic reviews, meta-analyses, consensus guidelines. The list goes on and on. So if you come to Western, what we'll try to do is find something that meets your needs and gets you motivated. The second thing we try to do is to give you as much mentorship and support that you need. We have a dedicated statistician who sits outside my office who helps residents design their data sets and their data collection, analyze the data, and can work with the resident. If you want to do it together and learn how to do the stats, we'll do that with you. And then our goal is to get you over the finish line. And the finish line of a project isn't just finishing the project itself and collecting all the data. There are three parts. You collect the data, you present the data, and then you publish the paper. Kind of like a triathlon. The triathlon is not over after the swim and the bike. You've got to finish the run. And what we want to do is get you over the finish line to get those publications. But on the way, you're going to learn quite a bit. You're going to learn how to collect the data, learn how to analyze it, and learn how to give presentations. Our mentorship is very thorough, and we will check your presentations before you give them at big conferences, and we get a bit picky about the details. Little things like the words you use, the pictures you show, the order you give them. We want those to be perfect, so that when you go out there, people will say, look at this resident. They look like they're going to be an outstanding radiation oncology researcher. And in the end, we know that our residents are the future of our specialty. In a not very short time, people like me are going to retire, and our residents are going to take over, and we want to hand over the baton and watch them run. We have lots of research opportunities for our residents, and we base the research projects on what their interests are. So if residents want to do things that involve radiation planning, we can do that. If they want to design a study and run that, we can do that. If they want to try to develop some consensus guidelines with experts in the field, we can do that. We have a dedicated clinical research unit whose job it is to conduct trials. So if you're a resident and you want to run a trial, we can help you to get a grant and run that trial. Really, the only limit is the imagination.